Let us never forget the privilege of doing this holy and necessary work. Give each one here everything we need to keep moving forward together, united in our mission, fortified by our purpose, and edified by the excitement generated by the vision of the future we are shaping together. We ask all this in your holy name. Amen.
Amen.
America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Do we have any citizens wishing to? We have no citizens wishing to address the board, so we will move forward with approval of our minutes. Are there any corrections to the minutes? If there are no corrections, I'll entertain a motion.
Second.
All right, it's been moved by Ralph, second by Zim. All those in favor of approval of the minutes signify by saying aye. Aye. Those opposed by nay. Motion passes unanimous. Okay. For my report, I'm going to turn over to Roger so he can do an update for us.
Thank you, Madam Chair. They actually gave me a remote control that I don't really know what to do with, but we'll play with it. I just wanted to give the board a quick update. On June 27th, Six Stones, a local nonprofit, did a groundbreaking on their new facility, which will be built via ground lease from JPS next to the Northeast Medical Clinic. We had almost 300 people attend the groundbreaking, and we're really excited about getting this started. I hope to come back to this board in a year. In fact, I hope even before then, maybe to have the board out there to see the facility and what it can do. We often talk about the patients and the medical care, but the social determinants of health and the other aspects that go into health care that may not be truly medicine, but food and clothing and job training are things that can happen or that will happen inside that building. We're really excited about it. And because the Commissioner Fickus spoke, and then there we are actually turning the dirt. So we had help. We raised over $7 million with the help of Tarrant County, the Amy Carter Foundation, as well as the Maybe Foundation, and a whole plethora of people throughout the community. So we're really proud of that. And I just wanted to, there was a lot of discussion and consternation in this board about a ground lease and how that would look and what would happen. And thanks to the hard work from Daphne, Karen, and the entire staff, we got all that done. The Commissioners Court got it all approved, and we broke ground, and we're really, really excited about to see not only the work that Six Stones can do, but what work Six Stones and JPS can do collaboratively. So just wanted to share that with you and appreciate the board. Thank you.
All right.
And I'm giving this back.
All right. Well, good job. I'm glad to see that we'll have the groundbreaking for that. Okay, next we will go into Dr. Duncan.
Yes, Roger, congratulations. It's a great partnership, continuously partnership. Just a real short update. It continues to be very busy for the hospital. Our ED has had some of its highest volumes. Of course, some of that has been heat related, given our hot Texas days here. And we had a busy July 4th in our ED and trauma area too. But the staff continues to step up and to continue to place the patient at the center of everything that they do. And so I personally want to thank all of JPS and the work that they do, and also thank the board for the support that you give to JPS. And with that, Madam Chair, that's all the update that I have.
Thank you. We will move into the rest of our agenda. We have Dr. Miles. How are you?
Thank you, Madam Chair. Yes, I am ready. You have the medical staff appointments and privileges in the red folder next to your iPads for your review. These are, again, fully vetted by the medical staff credentialing and privileging process, and there is nothing to report
Right.
other than to ask you for approval.
Right. So do anyone have any questions on those? Okay. Then I will entertain a motion for approval of the staff appointments and privileges.
Second.
All right, it's been motioned by Ralph, second by Roger. All those in favor signify by saying aye. Aye. Those opposed by nay. Motion passes, okay? Now, again, Dr. Miles, we are for your delineation of privileges forms.
Yes, ma'am, thank you. This starts on page 10 with the nurse practitioner delineation of privileges. This is a minor revision to the privilege form. The additions are in yellow on page 11, and it is simply adding the privilege of implantable contraceptive devices to their privilege form. Scrolling on, the provider-based clinic or PBC affiliate delineation of privilege form is a brand-new form. We have not had this previously. What this privilege allows folks to do is if they are 100% community-based, only working in an ambulatory clinic, not admitting patients, not seeing patients in the hospital or in the ambulatory surgery centers, this allows them to apply for this privilege form, which is a significantly contracted form. There's just not as many privileges on it, but certainly enough to let them do their very good work in the ambulatory area. But I just wanted to point out that that is a new privilege form for us. And then going on to page 13, this is also a new privilege form for moderate sedation. This has been about a year-long, well, maybe 10-month-long project to get this privilege form forward. We identified during a joint commission mock inspection that we had a gap in our moderate sedation privileges, and this will close that gap. So this is a privilege form that does not stand alone as its own form. This is language that you are approving to be added to any privilege form where there may be moderate sedation. That's a lot to say. So for example, if I'm a family practitioner and I do endoscopy, I do colonoscopies as a family medicine doctor, I need to have moderate sedation privileges. So we would add the moderate sedation language to the family medicine form to allow practitioners who perform that privilege to check in and be approved for it. It does not go on any privilege form where moderate sedation is part of their core privilege. Well, who gets moderate sedation as core? Anesthesiology, emergency medicine, oral and maxillofacial surgery. It's part of their core privileges to administer moderate sedation. Also, critical care routinely does moderate sedation as part of their core privilege. So this language gets added as a non-core privilege. A non-core privilege, so it's an option for people not in those specialties who want to do moderate sedation. So I'm happy to answer questions if I just muddled that completely and now I've confused you all.
My quick question.
Yes, sir.
Have we looked at the malpractice insurance for that type of injection?
It's a great question, DT. Although it is not a core privilege, it is a privilege that's commonly used by these types of physicians. We would not, I'm not an expert in medical malpractice, but I would not expect to change their medical malpractice premiums just because they're doing an additional privilege.
And these are less than 2 hours or something like that?
I'm sorry, it's less than what?
Less than 2 hours under sedation.
Moderate sedation is defined not by the length of sedation, it's defined by the depth of sedation. So it's somewhere between like a local anesthetic and full-on general anesthesia. It's somewhere in between. Moderate sedation patients still respond to commands. Yes, they do not require respiratory support. They are breathing on their own. They are not paralyzed. They have a subdued level of consciousness, but they are still conscious. So it's a twilight. If you ever had it, you'll know you're in kind of a twilight. You may or may not remember the procedure when you wake up.
Thanks.
You're welcome. Any other questions around that one?
I was just curious what specialties this would cover. You mentioned family medicine. What other specialties? General surgery?
It's primarily family medicine, right? It's not general surgeons. It typically do not give their own sedation. They usually have an anesthesiologist with them in the room. I believe, and I would have to check for you, Dr. Holland, but I believe that moderate sedation is added to radiology for our interventional radiologist because they all do moderate sedation on their own. So to be clear, this is when the family medicine doctor or the radiologist is doing the sedation themselves and they don't have an anesthesiologist in the room with them.
Does the building department knows how to code this?
I certainly hope so.
And can we get reimbursement for it?
Oh, there's definitely CPT codes around it, yes, and there's professional fees around it. So there are, and Sharon, I'm sure, is much more well-versed in this than I, but there are definitely charges around it. And if appropriately documented in the medical record, those would be charged and ascribed to the physician administering the moderate sedation.
So currently, Dr. Miles, how are these cases being handled? Do the family practice doctors have to wait for an anesthesiologist or a CRNA to be available?
Yeah, that's exactly what's happening right now, is there has to be anesthesia or CRNA support in the room, and this would allow these doctors to be able to do cases with moderate sedation without anesthesia.
So this should improve the overall efficiency of the hospital.
Potentially could improve efficiencies in terms of being able to increase the number of procedures with moderate sedation without an additional burden on anesthesia. I don't think that was the intention for the privilege form, to be clear. The intention for the privilege form was to close a gap we identified in compliance with Joint Commission requirements around moderate sedation. Okay, and the final one is on page 14, and this is APP and surgical services. And although this is not, there's no highlights in here, I can tell you the changes around this APP surgical.
It's on page 16.
On page 16, thank you. Oh, the highlights are on 16, thank you. I did not see that in my copy. Let me scroll forward.
Sedation.
Yes, moderate sedation is already on there because it's coming through today. So what will happen with these is, as we add the moderate sedations, you'll be seeing them come through. The level of supervision were the changes on page 17 in the APP surgical privilege form. So it's just changing the level of supervision required for want or privileges in pediatrics. That's clearly spelled out in their core privileges. I can't think of an example for you right off the top of my head, but I know we have at least one privilege form where it excludes pediatrics.
Can we make sure that it's excluded?
I'm almost positive it's the hospital medicine privilege form that excludes pediatric services because none of our hospitalists see children.
Correct. Okay. All right. Are there any other questions for Dr. Miles? Okay, then I'll entertain a motion to approve 1 through 4 of the privilege form. Zim?
Second.
Ralph, okay. All those in favor of approval of the privilege form signify by saying aye.
Aye.
Those approved by nay. Motion passes unanimous. Now we will have our committee reports. Finance, Planning, and Investment Committee, DT and Trent.
You to Trent first.
Okay, had our July 13th Board of Managers meeting. Remember, we did the master facility plan construction update. Also, staff gave us a report on the clinical engineering work that Agility has completed for the first quarter of this year. For today, there will be an RFQ for security consultant for the master facility plan, and also the construction manager at risk release of RFP for main campus hospital replacement. That's all I have, Mr. Chair.
And from the finance team, we accepted the report from our CFO for the unaudited financial report. We also have, did they load the single audit report on the portal yet? It is on the portal now, so you guys can look that up. And just for several highlights, the JPS had a consolidated operating income of about $14.8 million compared to our budget of $8 million. Year to date was $84.1 million for the 8 months ended in May. The largest revenue variance continued to be net patient revenue created by additional volume and favorable mix. and also the receipt of the HARP supplement funding that was not approved by CMS during the time of budgeting also as well. Salaries and supplies and drugs continue to exceed the fixed budget, but it's covered by the additional volume of the patient. Year-to-date, non-operating revenue have exceeded budget with a strong market performance and the sales of several properties. On top of that, we have 4 contracts were presented and approved, and it's in the consent agenda. That's conclude our report, ma'am.
All right, any questions of DT and Trent? Okay. Then we'll go into Governance Committee. Zim?
Thank you, Madam Chair. Our June 22nd meeting, during that opening session, Colin highlighted our current top risk, which include workplace violence, accuracy of coding modifier 59, cybersecurity, accuracy of coding modifier 62, accuracy of coding and building associated with bioengineering skin substitute products. The Government Committee was briefed on the work of the JPS 340B Committee, which is a subcommittee of Colin's Executive Compliance Committee. The Health Resources and Services Administration has notified JPS of an upcoming audit for which Colin anticipates no findings of noncompliance. 340B is a discount drug purchasing program which has an annual impact of $60 to $80 million. The program helps JPS drive health equity for our patients. Colin briefed the Governance Committee on the JPS Multidisciplinary Diversion Prevention Team. The MD team meets to review audits and determine the need for further investigations. Additionally, MD team meets when suspected diversion is currently taking place and when proactive surveillance reveals potential diversion. Drug diversion is a national problem in healthcare, with 10 to 20% of staff experience a substance abuse issue at some point in their career. JPS is ramping up a more proactive approach to monitor for known diversion behaviors with the desired outcome of improving patient and staff safety. There were no other matters brought in front of the committee, and it's my report.
Thank you, Zim. Do anyone have questions of Zim? All right. Then we have the next on our agenda will be the consent agenda. No, I'm sorry. We got quality. I'm sorry. Sorry, Margaret.
Thank you. We had our June 26th Quality Committee meeting. It was a little delayed just in transition of leadership. But on that meeting, we awarded 3 departments with the Charles E. Weber Junior Golden Mitt Award, and that is given for exceptional work and service to patients. The February 2023 award was given to Nutritional Services. March 2023 award was given to Inpatient Case Management, and April 2023 award was given to Patient Safety Assistance. The staff presented on 4 areas: clinical quality, regulatory readiness, patient experience, and workplace violence prevention plan. In clinical quality, there was a high-level overview of the clinical quality metrics associated with UTIs, CLABSI, which is central line associated infections, hand hygiene, surgical site infections, patient falls with hip fracture, left the emergency department without being seen, 30-day mortality, heart failure, and leapfrog hospital safety grade. For regulatory readiness, the staff shared an overview of readiness work being done to prepare for upcoming regulatory joint commission. The patient experience arm staff reported on fiscal year 2023 of the organizational goal update based on results from the patient experience survey, and highlighted a new approach to address patient concerns and facilitate communication to improve overall experience for patients at JPS. And finally, as far as behavioral health, they presented a report that's going to focus on workplace violence and tools that have been implemented to prevent it, as well as educational services that are going to be provided staff. And other matters for approval, the Quality Committee approved revisions that were made for 2 policies, one on guardianship and abuse, and neglect and reporting cases.
All right, are there any questions for Margaret? And Margaret, thank you for assuming the chairmanship for that committee.
You're
All right, appreciate it, okay? All right, now we go into consent agenda. Are there any items that anyone wish to remove from the consent agenda?
I'd like to remove item D under finance, the Medardis contract from consent.
Okay. Anything else?
I mean, are we doing the two policies, guardianship and abuse, are those consent, or is Jill
Those
going
are
to
part of
present
the
them?
consent. Mhm. Okay, is that it?
Yeah, I think that's it.
Okay, all right, yes. He want under finance D,
Taking that into close?
I guess we will need to take that into close before we vote on it?
I don't know what his question is. You just want it separately presented, or
I have some questions about it.
We'll do it in close,
Okay.
okay? So what I will ask is an approval of the consent agenda except for D. Okay? Ralph?
I'll second.
All right, Zim seconded. All those in favor of the approval of the consent agenda except for D signify by saying aye.
Aye.
And those opposed by nay. Motion passes, okay? Then I think that's it for open session. I don't think I skipped anything, okay? So what we will do is close our open session at 1:25, and as soon as we can clear the room, we'll go right into closed session, okay? I have to hit my deal for him. item that we need to take care of, and that is item D under finance. That is the approval of the price agreement between Maduras and Tarrant County Hospital District. So I will entertain a motion for approval. Okay. All right. It's been motioned by DT, second by Ralph. All those in favor of approval of this pricing agreement signify by saying aye. Aye. All those opposed by nay. Nay. All right, we have one opposition. Okay, motion still passes, okay? We have no further business at this point, so I will entertain a motion for adjournment. All right, so we are adjourned. Thank you.